Hi, this is Josh Bernoff, the co-author of Groundswell, which is a book about social technologies and how companies can take advantage of them. We looked at this across a bunch of different industries, including the healthcare industry. I'm here at the PRSA's Health Academy to talk specifically about that. And when it comes to healthcare, I think you'll find that there is more compelling reason for people who have various health conditions to connect with each other than just about any other social application. They want to get support from each other, they want to share information. At the same time, because of FDA regulations, it's very difficult for healthcare companies to move forward here. So part of what we're trying to get at, and we've done some research on this recently, is how can you take the level of risk your company is comfortable with to take advantage of that huge opportunity to connect with people socially in the groundswell. What we see when it comes to healthcare is, first of all, people are participating more and more in social applications for healthcare, whether we're talking about the American Cancer Survivors, the American Cancer Society's Cancer Survivors Network, or on places like WebMD, or in some cases on communities that have been set up by healthcare and pharmaceutical companies. Another thing that we've seen is that it's always been the case that younger people participate more in social technologies. Of course, healthcare tends to deal more and more frequently with older people who have more health conditions, but we're beginning to see people who are 35, 45, even 55 increase their level of participation in these social networks, especially when it comes to reading the information, if not contributing it. So this makes it more imperative for healthcare companies to pay attention because of the participation of older consumers in these networks. We've surveyed marketers recently to find out whether the recession was affecting their investments in social technologies. And what amazed us was the high level of support for actually increasing budgets in a recession. We found that over 90% of the marketers that we surveyed from medium and large size companies that were using social technologies plan to either maintain or increase their level of investment despite the recession. And that's a level of performance that no other form of marketing can match. The reason is because in a recession, word of mouth is more important than advertising, it's more important than direct marketing, and the way to energize word of mouth is through these social technologies. We've collected a lot of data at Forrester Research, including data on the level of social participation of people who are suffering from various kinds of medical conditions. Now, as you might expect, older people, for example, people with osteoporosis, participate less. But even more than the age skew, what we found is that people who have depression and people who have other mood disorders participate in social applications at a higher rate than any other disease category. I'm not sure why this is. I certainly don't think that blogging makes you depressed, but it may be that people who have these conditions are very much driven to seek out others on the internet. But for anybody who's trying to reach folks like that, you have to be understanding that social applications are very important to them. If you're looking for me, you can either go to our website at groundswell.forrester.com, where we have resources, including you can get access to some of the data. You can see my blog is at that site. And if you want to find me on Twitter, it's at jbernoff.